Everyone, it's Josh at Prescription Fitness Physical Therapy and Sports Care, bringing you another video today. It's a beautiful sunny day. I feel like this is going to be the last sunny day, so it's kind of shining off my head here. So if we blind you, well, too bad. So we're going to talk just quickly about the knee and sort of functional knee anatomy. So here we have, here's a right knee. So we're looking at the structural architecture of a knee. So we have the femur. Then we have the fibula, which is the outside bone here, which bears about 20 to 30% of our weight. And then we have the tibia, which is our shin bone. If we flip our kneecap out of the way, I don't know if you can really see that with the light that's coming through here. There's a little groove right in through here where the kneecap kind of sits into it. So if we flip that away and we look inside, we see our little ACL, and ACL is, it's one of those major stabilizers. It has a partner called the PCL, which sits in the back. So our PCL runs into the back. And these are sort of our primary stabilizers, which prevent our leg from sort of shocking back and forth. So as we're standing and moving. So sports injuries, a lot about ACL injuries and PCL injuries. On the sides here, we have two ligaments. These are actually outside, so surrounding this whole thing. So imagine that enveloping this whole area is the joint capsule, and the capsule is what holds in the fluids that lubricate the joint. It also adds stability to the system. So on the outside of the capsule, on the inside, we have what's called the MCL, or medial collateral ligament. On the outside, we have a lateral collateral ligament. And then there's some supporting ligament structures. There's what's called the PMOL, and then there's arcuate complex. So there's some smaller structures. They're support systems that reinforce the capsule in the back of the knee. So one of the more common injuries that we see are meniscal injuries. So we have our little meniscus on the inside here. Meniscus are made of fibrocartilage. So there's two types of cartilage in our knee. We have hyaline cartilage, which lines the articular surface. So if we take off the turkey drumstick and we look at it, we're looking at articular cartilage. The composition of it is a little bit different. It has a little bit more of a capacity to attenuate stress, and that's really how it works. And then we have these guys, which is more of a fibrocartilage. So the meniscus itself, and the meniscus, its major job, you can see that the femur itself is kind of round, the tibia is kind of flat, so it's like putting a marble on a plate, just slide off there. But and we took a rubber washer and we threw it on top of the plate, and then we put the marble on top there. It would stabilize that system. So unfortunately, just like any other joint, they're wear and tear joints. So over time, what happens is that our meniscus start to collapse, and we tend to see more collapse of the medial meniscus. So we start to get degeneration of that process. So the meniscus itself does have the capacity to heal to some degree, but it depends on where it is. So if we look at the meniscus, we pull it out of the model and we flip it up on its side, it actually has 3 zones. So we have an outer zone, a middle zone, and then an inner zone. And they're called red zones, red-white zones, or white-white zones, and that represents vascularity. So if it's in a red zone, it does have the capacity to heal. If it's in a white zone, it's like a hangnail. It's probably not going to heal. A lot of times it just kind of grinds itself down. So we used to do meniscal surgeries all the time. So you tear your meniscus, they go in there immediately, and they would take that and clean that thing up. But unfortunately, you can't just take out healthy tissue or unhealthy tissue. You're always going to take out healthy tissue. So they're not doing as many of the meniscectomies as we used to see, let's say even 10 years ago. But our meniscus do eventually, they degrade over time. It's like a rubber washer, or maybe it's like that pair of underwear that you pull out of your drawer, and you pull it and go that crunching sound as the elastic just kind of falls apart. So the meniscus, over time, we lose the ability to bind water, and so the meniscus itself starts to degrade, and we get these degenerative meniscal tears. So by the time we're in our 50s and 60s, we'll tend to see those types of things. So super common stuff that we treat all the time into the clinic. They just tend to go hand in hand with things like arthritis. And so as our medial meniscus, again, here's the inside of my knee here, as this starts to degrade, what happens is the knee itself falls like a tree that I took a big chunk out of. That's kind of collapsing this way, and so now we end up with this bow-legged type of deformity. So now we got this increased compression on this side, we get stretching on this side, and we end up with a bow leg and arthritis, and eventually maybe a knee replacement. But that's kind of a quick summary of common things in the knee anatomy 101. We can talk about more specific things. So if people have things that they're interested in, please feel free to reach out to us and go to our Facebook page It's again Josh at Prescription Fitness Physical Therapy in Geneva, New York.